Hi there and welcome back. Let's review mitral regurgitation or mitral insufficiency, one and the same thing. In the prior session, we kept referring to, while reviewing the mitral valve prolapse, about the mitral regurg, which means mitral insufficiency, one and the same thing. So we'll review in this session the MR or MI, not the myocardial infarction but the mitral insufficiency, or let's stick to mitral regurg for the simplicity. We'll get into the symptoms, causes, diagnosis, complications, treatment and underwriting. So MR or mitral regurg, as we know, let's just recall the quick anatomy, the basics or the fundamentals. The heart has four chambers, the left and right atrium on the top, and below them the left and right ventricles. As your heart beats, it draws blood from the body into the right atrium. This chamber sends it down to the right ventricle. From there, your blood is pumped to the lungs to pick up oxygen. When that oxygen-rich blood goes back to the heart, the left atrium takes it in and passes it down to the left ventricle. That chamber contracts or squeezes to send it to your body. You have a passageway between the left atrium and the left ventricle. That is the mitral valve. The mitral valve is supposed to be a one-way passage. It has flaps that should close behind the surge of blood it sends to the left ventricle. But sometimes that valve doesn't seal properly. That allows blood to flow backward through it, returning to the left atrium. When this happens, you have mitral regurg. You might hear a doctor sometimes call it mitral valve insufficiency. So what are the symptoms? Many people with only mitral regurg won't notice any symptoms. But if the condition worsens, you might have chest pain, fatigue, heart palpitations, shortness of breath, coughing, as well as rapid breathing. So what causes mitral regurg? It includes congenital from birth or due to heart attack, bacterial infection called infective endocarditis, a buildup of calcium, rheumatic fever, MVP that we reviewed recently before in prior session, or the mitral valve prolapse, certain appetite suppression drugs and cardiomyopathy are listed as the typical causes when it boils down to mitral regurg. How do we diagnose? Doctors usually find a problem with your heart valve by sound. If blood is leaking back into your left atrium, it will produce a murmur or whooshing sound. Your doctor can hear that through a stethoscope. A common follow-up test is called an echocardiogram. This uses sound waves to make a picture of your beating heart, similar to the ultrasound test given to pregnant women. Your doctor might also want to get a CT or MRI scan of your chest to help figure out what's going on. These are just two more ways to get a visual picture of your insides. So what are the complications? It includes blood clots that can create serious problems if they get to the brain or lungs. The condition can also cause fluid to build up in the lungs, straining the right side of the heart. If you have regurg, less blood is going to your body. Your heart works harder to make up for the shortfall. If this goes on long enough, your heart could enlarge, making it harder to pump blood and raising the risk of heart failure. It also can lead to an irregular or uneven heartbeat or a stroke. So, how do we treat? If you have a really mild case, you might need no treatments at all. Your doctor will still want to keep a watchful eye on you with regular checkups. Medications cannot actually fix a valve problem, but they can target other things that make regurg worse. Drugs called diuretics or water pills can lessen fluid buildups. Blood thinners can help prevent clots. You can take something if you have a high blood pressure, which makes regurg worse. In tougher cases, you might need an operation or a surgery. Sometimes a surgeon can fix your valve. If it has to be replaced, he can implant either a man-made device or one taken from a cow, a pig, or a person who died and donated the organ. So that summarizes the mitral regurg or the mitral insufficiency. How do we underwrite? As far as underwriting goes, follow the underwriting manual that your company expects you to follow, and make sure you make the final adjustments using your internal company specifics to remain competitive. Okay, let's take a break here. See you soon. Take care. Bye now.